Morning, everybody. I'm Chris Krasnowski, the Executive Director at the Wisconsin Institute for Healthy Aging. Thanks for joining us. I see some folks are still coming on, but we'll get started because we have a fairly full agenda today. So we were chatting a little bit before we started here about the nice weather, at least down in the southern part of the state. So let's get warmed up and tell us in the chat what has been your most memorable or favorite thing to do on spring break. Maybe it's a staycation, maybe it's a fun trip, but tell us in the chat what's your favorite thing to do on spring break. And if you went somewhere this year, tell us where you went. Angie Sullivan went to London. You win.
Yeah, I don't think we can top that.
Aloe had a staycation. Vacay for Carmen, great. Los Angeles and San Diego. Oh, Gulf Shores, Alabama. Jody had a staycation with family. I can get behind that. Danielle went to Florida with her niece and nephews. Morgan did some street hockey. Wait a second, that sounds very fun. Downtown Madison. Aaron's most memorable, a family trip to Washington, D.C. and Florida, driving. Oh, Ashley went to the Wisconsin Dells. How fun. I'm assuming the indoor water park, but maybe not, Ashley. That's great. Carrie did some dog sitting, enjoying time with family. Great. Can we hire you, Carrie? That would be, I'm looking for someone to do that. Indoor. Okay. Thanks. Great. That's great. Wait a second. Jamaica. Awesome. Oh my gosh, that sounds awesome. Take care of Carmen's dog. How awesome. Vacation for Jennifer Lefebvre too, but a lot of fun. Lambo tour, those are fun. Trampoline park, bowling. That's great. Staycations can be the absolute best. So great. Thanks everyone for sharing your spring break plans. That sounds awesome, and I'm envious. Although I agree, a staycation can be really pretty cool. All right, thanks. Thanks for warming us up this morning. You can see we have a full agenda. We kind of flipped things a little bit. We're gonna do some discussion around our falls prevention work. And for some of you, this will be a tiny bit of review, but always important to keep kind of talking about the planning that's going into the Falls Free Wisconsin Center. We're going to meet the LEAF grantees, the ones we haven't met yet. So several of them are on the call today. And we will talk more about the Healthy Aging Grant Advocacy, which has implications for falls prevention, chronic disease self-management, and our physical activity work. Then we're going to do some program updates quickly. And then lastly, we'll do our sort of meaty presentation around engaging volunteers, and we'll be breaking out into discussion groups for that. So with that, I am going to invite Dawn Eskow to join us. She's one of the LEAF grantees from, now I will remember, I forget where Dawn is from. Dawn will tell us where she's from.
Marquette County.
Marquette County, thank you. I should have written that next to your name, Dawn. I'm sorry. All right, just a second. Oh, I gotta move this out of the way. Come on. There we go. And
Perfect.
Dawn's PowerPoint up. Go ahead, Dawn.
Okay, thank you. Yes. So thanks for having me today. Dawn Eskow, one of the nurses here at the Marquette County Health Department. Talk to you about what we're doing so far with our LEAF grant. And so in Marquette County, we're a small rural county, but we've had 19 deaths from falls from January of 2020 to September of 2022. We started looking at our EMS data when they get called out for folks that have fallen, and we found that over 15% of those calls were for falls. And of those, 15%, 30% of those were repeaters that just needed what they call a lift assist. And as you all know, Wisconsin has the largest number of deaths from falls of all 50 states. Next slide.
Oop, oop, there we go. Sorry.
So our goal of our LEAF grant is to decrease these repeated falls that EMS gets. So our first strategy was to involve some community partners, and we did that. We have a group, myself, Amelia is our registered dietitian from our ADRC program. Jordan is our assistant EMS director. Eric is our local pharmacist. We have Renee, which works in our outpatient clinic, and Sarah is our occupational therapist. So this is our LEAF team, and we're really, I think it's a great team, and we're working very well together. Next slide. We're trying to use a multidisciplinary approach to assess these clients that are the frequent flyers. So what we do is we offer them a home visit, or if they don't feel comfortable with that, they can come to the health department. And we have a little gift bag that we give them, you know, some free items, medication box, some non-slip socks, night light, a toilet light, some brochures. And we have our team assess them as far as their nutrition, their gait, medications, vision, blood pressure, depression, and just some home safety tips. We also bring them free lunch. We're also going out into the community to provide some events. Marquette County has the first weekend in May, Fish and Fun, which is like one of our larger community events, and we will have a presence there. We're going to have a booth. We already did our Endeavor Supper, which is a monthly supper that attracts like 50 plus folks. So that was a good outing for us. We're going to attend some of our dining sites. We have information in the library, social media. We're working with our ADRC for Picnic in the Park, which they do 3 times in June, July, and August. So we'll have a presence there as well. And we're partnering with our Wisconsin Churches Dart organization. Middle of May, we're going to have an event at one of their churches. And then our ADRC is offering their Stepping Up Nutrition class and our Walk with Ease classes.
Yep. So
we wanted to set up a process to help us identify these folks and offer resources in real time. So we're working with EMS, and they've actually modified their software. So when they go to one of these calls that is a fall without injury or just a lift assist, they talk about our program and they leave one of our note cards with them. And then in their software, they enter the person's address, phone number, how they answered a couple questions, and if they would like a referral. So then we get that referral via email, and then we reach out to that person. I start by sending a letter just explaining the whole process, and then I follow up with a phone call. We're also working with our local medical clinic to have them refer patients to us as well. As mentioned earlier, we're doing social media ads, libraries, flyers around town, just to advertise our services. And that's what we're doing so far.
That's great. Great. Wonderful. We're really pleased, and it seems as though you really hit the ground running with the sleep project. So terrific. We'll look forward to hearing more when we get closer to the end of the project.
Sounds good.
That's great. Thank you. Next, I'd like to invite Haley Couch to unmute and tell us about your project.
Hi, can you hear me?
Yes.
Yeah, okay. So we are kind of doing the same thing. So we currently already are working with 2 EMS departments in Kenosha County. We work with the city and then we work with one in the county itself, Twin Lakes, Wheatland, and Randall. So every day we get a fall report from those 2 agencies, saying if they were treated and transported, if they denied any help, and then if they do agree to a follow-up, we call them after 1 to 2 business days just to follow up, see how they're doing. And then we offer them some resources. So we have our long-term care screens, options counseling, the health and wellness classes that we offer, and then also durable medical equipment from our loan closet. So our grant that we were applying for was to get a greater amount of people to say yes. So as of 2022, we had 2,000 falls and about 5% of them said yes. So this year, at the moment, I just did my numbers this morning, we have 562 falls since January 1. And we have about a 16% yes rate. So we have already doubled from last year, which is great. So we are actually working with a EMS department down the street from our offices here at the ADRC, and they are doing a leave behind card. So we had designed that and also left a magnet as well. So we are targeting the families more than we are the consumer themselves. So the leave behind cards was the great idea, as from an EMS of the EMS department themselves. They said a leave behind card and a magnet. So we are also giving a running pack. I'm gonna put air quotes around it. So it's a fanny pack / crossbody, and then inside is a night light, a pedometer, and then an exercise band. I had done a survey last year, and that was the majority that people were interested in, was a night light or the pedometer themselves. And then they also get a exercise band just to do some exercises in-house if they would like to. We also offer them a PT evaluation from 2 different companies that we do work with. And that is how we are doing with our grant. We're doing pretty well.
I'll say, I mean, you already have data, which is pretty amazing for having started this so recently. So, so great to see all of you talking about working with your EMS. We know what a challenge it has been and how important
Good. Thanks, Angie.
the issues are when it comes to, falls and emergency services. So wonderful to see those partnerships develop. That's so great. Thank you. And lastly, I'll ask Danielle Jacquet from De Pere. You're on.
Hi.
Hi.
So yeah, from De Pere Health Department, I'm Danielle Jokey. It's a hard one.
Sorry.
And we are doing a couple things with our LEAF grant. So we did have some fall prevention programming and data collection in place prior to this. We do work closely with our EMS services, and we're getting reports from them daily on the falls in the area. However, our health department serves only City of De Pere limits. Our fire and EMS serves a greater area that includes Leadview and Lawrence and outside of the city. So part of the grant we are having, and we're a tiny staff for 5 full-time people. So we're having a limited term employee weed through all that data, pull out just City of De Pere, also read through those narratives and see where are people falling, why are people falling, like really deep diving into that data that we're getting in, looking at race, age, gender, all those good things to kind of see what our specific demographic is for people who are falling and having injuries from falls and hospitalizations and all that kind of thing. So that's kind of piece 1, so that's ongoing. And then piece 2 is we are doing the bingo size program through Western Kentucky University. So we actually just had our first session on Monday. We had about 8 participants. I'm hoping there's going to be more on Wednesday. People are telling their friends and bringing people along, so we'll get a few more signed up, I'm thinking. But that is fall prevention, trivia and education, exercises, and bingo all in one. So we provided coffee and there's prizes, there's music to go along with all the exercises, which they really enjoyed. So that went very well, and hopefully will continue to go well. It's going to be twice a week for 10 weeks at our community center. So we'll be doing that. And then we also did some night lights and File for Life magnets for the fridge that has all their medical information, allergies, emergency contacts, all that good stuff. Our fire and EMS give those out to all our falls already, and we were running low, so that was part of this grant. And then night lights will be for fire EMS. We have a fall and fire prevention program already in place called our stay-at-home assistance program, where we go out and do home visits and take a look at what might be causing falls. And also the fire department checks smoke detectors and carbon monoxide detectors and things like that. So we can give those out at that as well. And then we also have a mobile unit that was part of a different grant that we're going to be taking out to a bunch of events this summer. So we'll have some giveaways then related to fall prevention for that. And then kind of the last piece, there's a lot, is mugs for rugs. So originally, before we knew what bingo size was, we had planned a one-time event for fall prevention bingo through a different program. And we were going to do mugs for rugs at that. But now that we're doing bingo size, that's spread out over that 10 weeks. But we are part of a fall prevention coalition here in Brown County that's having its own separate event that I'm a part of planning. That will be in September, and it has a whole bunch of speakers, a pharmacist, it has balance screenings, all kinds of great stuff. So we're actually going to do the Mugs for Rugs kind of campaign for that event through that coalition. So people can bring in their scatter rugs that they shouldn't have, and they will get a reusable insulated coffee mug for doing that. So that's all I
Wow. That's all? That's all you have?
have.
Amazing to hear what all of you are doing in your communities. Our great hope and when we get to the end of this project is that we're going to have so many different best practices to share with folks in other communities, so that we've developed and found ways to organize some of these programs and get them going in communities and embed them there. So really wonderful. Thanks to all three of you for sharing some of the work that you're doing with the LEAF grants. So I'm going to move on. Speaking of falls, I'm going to talk now about the Falls Free Wisconsin Center. This is not new to probably almost all of you. I know you've all been hearing us talk about the Falls Free Center and our plans for it. I'm going to move quickly through some of these initial slides because I don't think that I necessarily have to convince any of you that falls are a problem. But as you know, and as has been mentioned here this morning, Wisconsin has the highest death rate due to falls of older adults. So we know, there were 1,785 reported in 2022. That continues to increase year after year. We're seeing, larger numbers, and I think we will. The pandemic will have also had an effect that we will begin to see what that looks like down the road. In 2021, there were over 43,000 emergency department visits due to a fall for older adults, and that's up 12%. So we know this is a problem, and obviously we have additional data, and then we'll be talking about that in a second, additional data. Likewise, and as you've heard from the LEAF grantees, we know older adult falls represent a high percentage of the EMS calls. And so that creates, these additional pressures. Not only are EMS staffs, they have challenges, in terms of having enough folks, particularly in volunteer to fire departments, but then having to do lots of calls, and a high percentage of their calls being older adult falls puts a lot more pressures on the systems. So in Oshkosh, for example, they had in a year, 21% of their calls, a little over that, were falls related. 46% of those folks fell more than one time. And of those who fell some people who fell 5 or more times were 30% of those calls from fallers. So they're seeing people more frequently. Preaching to the choir here, I know. One other thing that I think is important to know is that older people are concerned about falls. Our barriers survey bore that out in terms of folks, the 700 people that we surveyed, and who are asked which of the following is a concern for them. over 500, almost 550 people said preventing falls was a key concern. So we know falls are a problem in healthcare settings. We know they're a problem for emergency services. They're clearly a problem for older adults and their independence. And so clearly we need to do something about that. So the Falls Free Wisconsin Center is being developed, and we intend to launch that in September of this year. This was something that we received federal earmark funding to be able to create the Falls Free Center with several audiences in mind. For consumers, we're creating a virtual space that will have positive, upbeat, you can do it virtual, tools and resources for consumers to find falls prevention information, strategies, programs, motivation. We know older people believe falls are a problem, and we want to provide them the tools and resources to be able to stay independent. So there will be a consumer guide. Each of the pieces in the guide will be available online and downloadable with pull apart sections. So you'll be able to find things by topic easily and download them, utilize them on the website. And they'll also be part of that will be a planning tool for safety and mobility. So a checklist for people to utilize. Again, for consumers and families and their caregivers, we will be doing a substantial promotion plan so that people will find out about the resources of the center and be driven to that. Part of that is going to include a media tour where we will be coming out to different locations around the state. We will be letting you know where those will be. Probably some of our LEAF grantees will see us show up in their communities, and we'll be working with the media to raise awareness of the center and the resources available. We're halfway through, I would say, the development of the virtual home walkthrough, which is sort of basically a link that people will be able to follow and move themselves through an actual home, not an animated version of a house, but an actual home where falls hazards exist. They'll be able to hover over places where they believe a falls hazard may be, and a pop-up will tell them, yes, this scatter rug is a falls hazard. This is what you can do to rectify that. And then once they finish the tour and put their county in, we will be directing them to local falls prevention resources in their area, in addition to falls prevention programming that we know about. We'll have interactive quiz that we currently have to teach about falls prevention strategies. We're continuing to develop relatable stories. People are moved by the experiences of other people. So part of the strategy here is to make sure people don't feel like they're the only ones. And then, of course, access to the evidence-based programs, like you've heard about bingo size, we know our Stepping On and Pisando Fuerte falls prevention programs, and others. We're going to be supporting health systems, managed care organizations, emergency services like EMS by providing the tools and resources, as you heard talked about here this morning, tools and resources for them to provide resources to people as they encounter them who have fallen or are presenting in an emergency department or being hospitalized. So some of these tools are being developed with clinicians and public safety professionals in mind, so they have these resources. We want to also be a source of best practices or systems development for clinicians and public safety professionals to be able to identify strategies that they can use locally if they don't have anything currently. We'll obviously be supporting the local falls prevention initiatives, so similar to these LEAF grantees, but also local falls and injury prevention coalitions and others. We really want to create a coordinated approach to falls prevention and provide tools and resources to everyone. And lastly, convening the Falls Free Wisconsin Coalition to coordinate these efforts. So inviting others who are interested in being part of the falls prevention work from all of these areas, public safety, healthcare, community-based organizations, our provider network, all invited to be part of the Falls Free Wisconsin Coalition efforts. For program providers like yourselves, what is the Falls Free Center going to be? Obviously, this virtual space, as I've described it, that you can refer folks to, to be able to find falls prevention information, programming, tools. This will be a space that will be, widely accessible to everyone. We hope also, and we'll be sort of promoting this towards not just consumers, but their families and caregivers. We know they drive a lot of the activity when it comes to an older adult fall, and creating some supports around that. We've also are in the process of creating a data mining and sharing capacity so that we can provide you with accurate information about the issue of falls prevention and local data for falls. And I'll show you that in a second, because we do have some of that data developed and we'll be sending out. Providing resources and technical assistance for local or state groups to launch falls prevention efforts. So like the LEAF grantees, we want to support local falls coalitions and recognizing their own community assets, be able to support work that's ongoing, understanding that every community may be a little bit different in terms of what they're able to do within that community around falls prevention. And again, supporting and providing coordination to the Falls Free Coalition. So shifting gears a little bit, as I mentioned, we received 1-year funding to create the Falls Free Wisconsin Center. But we recognize we're going to need long-term support to ensure that the Falls Free Center exists and lives, and we're able to provide the kind of tools and technical assistance beyond the end of the earmark period. So we're working on a state budget appropriation to support the health promotion programs such as falls prevention, our chronic disease self-management programming, and physical activity programming. And that comes in the form of these healthy aging grants. So the history around this is that in 2015, WIHA was the recipient of funding that came to the State Department of Health Services. This was during the Walker administration, and Senator Luther Olson was the champion for these healthy aging grants. And it was I shouldn't say not a big amount of money. It was a $200,000 annual state appropriation that supported evidence-based programming in Wisconsin. This year, and then it sunsetted. So after 2015 and 2016, those resources were no longer available. This year, there is opportunity within the budget. The governor's budget included healthy aging grants, $1.2 million, which is $600,000 per year over the biennium, support evidence-based health promotion programming in Wisconsin. So we are obviously in support of these healthy aging grants. And I'm just gonna click forward here a second so that you can see what the funding for this may support. And that again is our Falls Free Wisconsin Center, managing our chronic conditions and physical activity programming. So we have this document that we put together that we'll be sharing out after this call, when we do our WIHA update with the recording for this call. And we are asking our partners to help support legislative activity to ensure that these healthy aging grants are part of the state budget. What does that look like? As I said, it's a $600,000 annual allocation, support for the Falls Free Wisconsin Center, including support resources for the LEAF grants, a public awareness campaign. As I mentioned, we're going to be doing some substantial promotion of the Falls Free Wisconsin Center, in part because we know that these resources exist in lots of places, but people don't know that the resources are available to them. So really a huge part of what we know we need to do is to promote the resources so people are aware. That's key. And then obviously providing the resources and technical assistance for communities. So having staff available to provide technical assistance as communities are looking to do falls prevention work, or promoting their chronic disease self-management programs or physical activity programs. So here's our ask. We're asking you all to consider contacting your state senator or state representative or both, and let them know you support the healthy aging grants. We'd love to hear about if you are able to send a note or make a contact with your legislator, we're asking you to do this next week during the week of April 17th. We are working in partnership with Wisconsin Aging Advocacy Network, the group that is supporting ADRC funding, funding for older adults in a variety of different ways, transportation, senior dining, all the kind of programming that happens at the county level. We are part of that, core member of that organization. So during the week of April 17th, we will be doing a big push to support the health aging grants. And we ask you to also help us find folks in your community who have a fall or have a friend or family member who's fallen and is interested and willing to tell their story, or someone who's taken a stepping on workshop and also willing to tell their story. We know that, you know, data moves people to act, but we also know that personal stories, and so many of us have personal stories and know people who've had a fall and how devastating that can be. We're asking you to consider giving us information, letting us know about falls or other programming that you know has been supportive of folks in your community. So people who've taken a chronic disease self-management program, for example, a physical activity, and who are willing to say this program really made a difference for me. We would love to hear some of those stories. Just a few talking points when it comes to if you're able to and willing to send a letter to your legislators. A few talking points, and I've been meeting with legislators, so some of these are I think critically important for you to know. I think there is a bit of a belief that older adult falls are inevitable part of aging. I have heard that from some folks that prevention isn't necessarily going to make a difference. And we all know different, obviously. We know our evidence-based programs can make a difference for folks. So we really need to dispel the notion that falls can't be prevented. And so again, we have some of those tools and resources that we'll make available to you post call so that you can make a case for that. And obviously we know that evidence-based programs such as Stepping On, but also others are evidence-based to reduce falls. How does the funding for the Falls Free Wisconsin Center help reduce falls? Certainly by raising awareness. I mean, that's the key, that people need to know that there's strategies that they can use to prevent a fall. We'll be launching this robust promotional campaign to educate consumers and their families. We will be providing these consumer education resources. And again, as I've kind of outlined, those things will be easy to access. Our goal is to get people to know that they exist, including things like how to safely get up after a fall. We can, if people do have a fall but don't get injured, we want to help them be able to, you know, learn strategies for actually being able to get up from a fall rather than needing EMS assistance. How does funding for the Falls Free Center help reduce falls? Certainly by, again, this is just an extension of the first slide. Funding and supporting local efforts. So we want to be able to continue to offer funding through LEAF grants. We'll be able to provide this localized data and providing these materials and resources. And then through creating these collaborative approaches to falls prevention. So by convening the Falls Free Wisconsin Coalition with partners from healthcare and emergency services and Aging and Disability Resource Network and others, we can create and develop a more coordinated approach to falls prevention and, you know, help communities not have to reinvent the wheel, but to look at their local assets and local opportunities and be able to do falls prevention. Then older adult falls have a significant impact on public safety and EMS. This is another key point, and this is something we're hearing from legislators that is a pressure point for them currently, that they recognize that emergency services are lacking in some communities. In some places in northern Wisconsin, it's all volunteer, and they're having obviously harder times getting people to volunteer for these positions. So definitely raising the issue of older older adult falls and their impact on public safety is a key and something to talk about if you're able to contact a legislator. As promised, I said we were working on falls data. So Suzanne, who's not able to join us today, but Suzanne from our staff has put together several data pieces that you can use locally to talk about falls prevention. The first is an average cost of falls per person, so the amount billed for the fall in an emergency department visit. And then she kind of took a look at it from a 2016, 2017, and then again 2020 and 21, and showed the percent of change. So for example, in Adams County, the average cost of a fall was $1,283 for an emergency department visit. That went up to $1,700 by 2020 and 2021. And likewise, you can see hospitalization costs as well per individual. So this is all broken down for you by county. And you can go in and take a look. We will be sending this out through the WIHA update newsletter, which will come out this week. So watch for that because you'll be able to take a look at your own local falls data. Likewise, we also are including the age-adjusted rate of falls injury-related ED visits and hospitalizations. So you can see in Adams, similarly, we broke it down by 2016 and 2017 and the percent change from that range to 2020 and 2021. So you're able to look at your own county and look at the age-adjusted rate of falls injury-related ED visits in that span of time. And if you have questions, you can contact us about any of the data you're seeing, and you'll see again that percent change. With hospitalizations, we noted that we think there is some COVID-related question marks there because we did see some of the hospitalization rates decline, but it may be that people were not presenting or hospitalized for some of these things, again, because their hospitals were full of COVID patients. So we don't know that for sure, but we're trying to find out what some of the differences in the rates were. So all of this data will be available to you. We also will be including a sample letter or email. So if you are willing to do some advocacy work on this issue, we've created this sample that you can kind of follow and then put in your own personal content, kind of following the track of why I'm writing to you, why this is an issue, and we'll have the issue brief so you can plug in some of that information, why this is important to you personally, and you can share an experience, a personal story. What do you want legislators to do? And ultimately, we want them to support an appropriation for the Healthy Aging Grants in Wisconsin, and then a thank you. So it can be fairly simple, and we've provided you with something to get started if you're willing to do that. I won't go through all of this, but these are some of the key committees where legislators who have power, the Joint Finance Committee, predominantly have power to make change when it comes to the budget, and we'll be approving the budget items. We've highlighted the counties that have gotten LEAF grants just because, so we're kind of keeping track of where the LEAF grants and what committees the legislators are on. And this is the Assembly side. So both in the Senate and the Assembly, there are members who are part of the Joint Finance Committee. They're the ones that have the most power when it comes to budget decisions. So those are the folks that were doing the most concentrated work. But we encourage you to contact your state senator and representative, regardless of what committee they're on, to let them know that you support these healthy aging grants. And this I won't go through, but this is for you to find your senators and representatives. There's a legislative hotline also where you can leave messages, but if you want to send a note, this is where you'll find that, and we'll put this all into the WIHA update so that you have it at your fingertips. And that is it for our falls discussion. So if there are questions, I'm happy to field those. Otherwise, Otherwise, I will move us along. You will be getting all of this in the WIHA update newsletter again. So don't worry about copying anything down. We will be sharing this all out with you yet this week. All right. If no questions, then I'm going to turn it over to, I think, Erin, to talk a little bit about the WIHA consumer news that was recently sent.
Yes. Good morning, everyone. So some of you may have seen or heard, we talked about this, I think, at the last office hours as well. We are publishing a consumer-based newsletter, which we are calling the Age Well newsletter. Can you see my screen currently? Just to double check. Okay, good. So this is a preview, or this is what the newsletter looks like. It went out on 4/7, so just 4 days ago now. And we sent it to all of our past participants that had an email address that was working. So we sent it out to just under 10,000 people who received the newsletter. We have an open rate currently of 35%. And you can just kind of take a look at the layout of what we have here. So we have a brief little overview about what's included in the newsletter. Then we did include this blurb because some of those past participants might not know why they're receiving this or even who WIHA is. So we just included that brief little blurb there. And then if we scroll down, we have some highlighted stories. Newsletter has those stories and then a lot of interaction with buttons and such. So we start with the spring 3 tips and a little bit about information about what WIHA is, buttons to visit the WIHA website, what aging well means to people. We had people click and say what they thought aging well meant to them. So far, we only have 5 responses. 3 out of the 5 said my body works the way I want it to. And then 1 person said, I feel like I am giving back to someone or something. We can learn more about WIHA programs here. There's a little video that they can watch about what WIHA is. Then we do falls prevention. So a little bit of information for that. It can take the falls risk assessment or take our knowledge of falls test. And then we have just a little article here about doing a focus group to provide some information if anybody would want to do that. Our featured program, Living Well, so we plan to feature a program with each newsletter. And then they can learn more about that. A little bit of information about diabetes, another find a workshop button. So really trying to emphasize those find a workshops. And those will point back to workshops in your communities. And then at the end, we just had a little check-in about whether the newsletter was relevant to them. So we had 104 responses for that and 93% said yes. You can see this. So this is what the newsletter looks like directly in people's inbox. And then we also are featuring that on our website. So if you scroll down, you can see that right here, that will pop up. We're planning on about bi-monthly to send out that newsletter. And when we do that, we'll post it on our website as well. But if you were interested in subscribing to this newsletter, you all will get the WIHA update, which is our newsletter for professionals. This one is really focused on for consumers. So if you're interested in that, you can always subscribe to our newsletter here at the bottom of any screen, or if you click on this, then it will pull that an overview of this newsletter on too, and you can subscribe right at the top of it. Like I said, we are planning to run this newsletter about bi-monthly or every other month, and out to all of our past participants, just to kind of give them more information about WIHA, about all of you, and then about information on how to age well. I think a lot of people are interested in that and finding out more information. So first, we'll just take a couple minutes, see if anybody has any feedback. And then we're also interested in ideas for topics for our next issue, which will go out probably late May or June-ish. Thoughts, feedback?
I think it's a great idea.
Great, thank you.
Oh, Jody mentioned scams. Right, Jody, you want to unmute and mention, say what you're thinking?
So many older adults just have, mentioned like I get a text or an email and should I open it? Should I not open it? Asking for this, asking for that. And some of them are, and I'm not ripping on people, it's smart enough to not open them, but some of them are like, oh my gosh, I could help this person or whatnot. And so many people are just getting ripped off by these scams, and it's very sad for the older adults. I mean, of course it's sad for everyone, but they're just very vulnerable population, and that topic has come up a lot.
Yeah.
As a topic for the newsletter, you're thinking?
Yes, I'm sorry.
How to avoid it.
more specific on that.
Yeah, no, but like understood, because I mean, we are sensitive to the idea. We want people to be thoughtful about that. So, so that absolutely, I think that's great that you raised that point. When we really conceived of this idea, we were thinking of it in a couple of ways that it could be, we're hoping to raise awareness with consumers so they start believing that they have some ability to control or manage the ways that they stay healthy. And so part of this is sort of priming people to be thinking more proactively about their health. Another thing is, though, that we can help promote local programming. So when people click the Find a Workshop button, they will be able to search within their community for different workshops. So critically important then that, program providers who have workshops coming up, get their workshop notifications in as soon as possible. So as these go out, their workshops appear on the WIHA website, because that's where we're driving people to find those. So, so yes, absolutely. That's great. And again, we're not just thinking about the programs that WIHA does. We're really looking at this in a much broader sense. Like what types of things do we know are practices that support good health for older people, like good sleep, like brain health, like, all the stuff that people have interest in. So we're really want to hear from you all too, as to what you hear from folks about.
Yeah, and Carol said that she'll promote it at her workshops too, and feel free to do that. If anybody wants to just mention it during a workshop, you're welcome to do that, and anyone can subscribe to the newsletter just right on the website.
Yeah, Carolyn mentioned doing physical activity outside safely, and the connection between mental health and nature. That's great. Absolutely. Yeah, we want to move sort of in all of these directions. Our niche here is that it's Wisconsin based. So we will be trying to direct folks to resources, tools that are available to them here in Wisconsin. And then we're really looking at this again, broadly, like, as you say, mental health and nature, what are the connections for people? How do we support health really across the lifespan and, across the dimensions of wellness, basically.
Can you print that thingy, Bobber?
It actually, it can be printed. The only downside to it is that when it does print, it sort of prints in chunks, based on your paper size.
Yep.
So when you'll see it prints like that.
Okay.
So that's the only downside. We want to hear from you if you, as we've published these and we send them out. If folks have their own local newsletters and want to be able to republish some of the articles, if that's simpler for you, let's talk about that, because, I think once we've published it and it's been out for maybe a month, we feel like you should be able to utilize some of these resources in your own local publications too.
I just know a lot of people up here don't go on computers. A lot of older adults.
Sure.
They just don't go on computers. They don't want
Yeah.
to, which is
No.
fine. That's just why I asked if printing was available, because they would love a paper copy of it.
Sure, absolutely. And the other downside is they can't click into anything, right, when it's on paper.
Sure,
So
right.
we'll have to figure out, we've talked about that. And, if you feel like there's a lot of interest and need for that, like we could maybe produce this in a way that had a web address instead of a button. We can talk about how to do that. We want to make it usable for everyone. So we'll see what's the best way.
Sure, thank you.
Mhm.
By the way, we still have like 1.5 or 2 feet of snow up here.
Woo!
Oh, I'm
Summer
so
here,
sorry.
Jody.
But you know, it actually has melted fairly fast. So hopefully with the 70 degrees it's supposed to be the next few days, it'll be
Yeah.
gone soon.
Yeah. All right. Great. Well, thanks everyone for the feedback on this. And I think we'll turn this now over to Jill.
Awesome. Lots of good stuff today. Good morning, everybody. So what I want to engage us in discussion with over this morning is the topic of volunteers. Before I get into kind of a more official, actually, yeah, let's do that first. I'm thinking of order here. And let's talk about volunteers, volunteerism. We're going to engage in some discussion as well. We'll have some breakout rooms, and then I want to apply that to some of our programs that we're all working on, specifically Stepping On. We use a lot of volunteers when it comes to peer facilitators and things like that. So I will go into a little bit more specifics with some technical assistance around that. So I'm going to share my screen here, and we're going to go ahead and get started. If anybody wants to take a little stand up stretch break for a second while I'm pulling it up, go for it. Okay, so we have talked about volunteerism for quite a while. And if you remember, I believe it was last year, maybe about a year ago, a little less than a year ago, Erin did a presentation on volunteerism. And we put together a volunteer toolkit for you that is on our website. I'm going to review that with us in a little bit here, but I also wanted to kind of reframe the topic of volunteerism a little bit and how it relates to individual health. So not necessarily the recruitment of our programs, but how does it relate to the health of our community members and ourselves? Erin and I were able to attend the Aging Conference in Atlanta a couple weeks ago, and we had some great discussion around this topic of volunteerism and health. So we often think of volunteerism as something that we want, that we need in order to be able to grow our programs. We want to recruit volunteers, we want to retain our volunteers, and not in a bad way, but to grow our programs so that we can improve the health of our communities. But what if it's more than that? What if volunteerism itself can be a health education intervention or a health education strategy in and of itself? So that's kind of what the reframing is that we want to discuss today. Because volunteerism actually is, and you probably all know this, but I mean, we've heard it before, but it's not necessarily top of mind. And maybe that's just me, but I think of volunteerism a lot as, you know, getting help, engaging people, and yes, of course, it's of benefit to them, but it really is an opportunity for us to improve the health of the volunteer, which is really, really cool because we get lots of benefits here. So I just wanted to point out some, like I said, we probably have heard this before, that it improves mental health. We know that it improves, you know, mood and socialization and things like that, but there actually are documented health benefits to volunteering itself. So this is a lot of information. You don't have to read it. We'll post this, but I just wanted to point out that there have been, and it's been going on for 10 plus 20 years, that there's been research out there that shows it. So it was just interesting, at least for me, just to be able to look at what that research was showing and how much research is out there specifically about the health benefits of volunteering. So we know that there's positive effects on decreasing depression, life satisfaction, overall well-being. And then specifically, they looked at mental health and physical health for, like, you know, what kind of volunteerism, what kind of volunteering yields those results. And really what they're finding is that when people are like engaging in continuous volunteer opportunities, or when they haven't volunteer much at all, and then they go from not volunteering at all to volunteering, kind of like physical activity. You see the most benefit from when you first start doing the activity versus doing it a little bit here, then stopping, then doing a little bit there, then stopping. So that just shows us that we have an opportunity to continually engage people in volunteer opportunities. But we know now we know that there's not only those decreases in depression and things like that, but there's actually the correlation now between physical health and decreased mortality rates for those people who are engaging in those continual volunteer opportunities. So really interesting to see. Whoops, I think, was there a question? Does somebody have a question on it? Not yet. Okay. So really interesting to see. Then we also know that there's additional benefits. So not just those, what the top of mind we think of, but there's actually, when you think of the dimensions of wellness, we think of the physical dimension of wellness, our physical health, we think of the mental, emotional dimension of wellness. We've been talking about that. But what about something like vocational wellness, or sometimes it's called career wellness? That is more of a sense of purpose. So you're doing an activity that gives you that sense of purpose. It doesn't have to be a paid career position that does that. So when a lot of times when we're working with older adults, they are not necessarily in a paid career at that point in time, but they are volunteering, and that still is career wellness. That is that vocational wellness. So when they're engaging in volunteer opportunities, we are seeing an increased sense of purpose, because just like they did when they were doing a paid career, that sense of purpose still comes from doing meaningful work. So especially when they're volunteering in something that they think is meaningful, they believe is meaningful, which goes back to our discussion on matching people with volunteer opportunities that are a good fit for them. So we also know that older volunteers are seeing that greater amount of life satisfaction and self-esteem than younger generations. So not that volunteerism isn't beneficial for any of the younger population, it is, but the traditional, the studies that were looking at this were showing that the younger population is already engaged in some sort of other paid career that they're getting some satisfaction and purpose out of. So that's where we see that larger benefit. So it makes sense. And then we know that volunteer opportunities increase social wellness, because we can increase social interaction by either new relationships, a totally new network that somebody's hasn't been a part of before. And that is still based on those common interests, because if you're matching your volunteers along with an activity that they feel a sense of purpose over, they're going to connect with others that have that same sense of the same values, same sense of purpose over that kind of activity. So there's like no downside here. There's just so much, there's so many. So it's a good reminder for us to know that it's an ask to engage volunteers, because we need help with our programming. We need help getting this off the ground so that we can improve health. But just in and of itself, that volunteering is improving someone's health. So you're doing a lot of great work when you're engaging volunteers and providing that opportunity for them. So it's an opportunity for them just as much as it's an opportunity for your program growth. So I'm going to take you to our volunteer resources page of the website just real quick, just to remind everybody where it's at. But we have that on the WIHA website. So I'm just going to pull that up here.
While you're doing that, Jill, I'll just share it's one of the things that we learned at the On Aging conference last year from the last week, 2 weeks ago, from the American Society on Aging. There was a presentation by someone, and he was saying that 2/3 of people that live over the age of 65 are alive right now, because the death rate was so much earlier in life previously. 2/3 of those people are alive right now in this moment. And that 76% of retirees do not volunteer, not even a single minute. So if we all know that that volunteering can make such an impact on individuals' health and quality of life, yet the vast majority of people aren't doing that, that's a big opportunity for us to recruit them and help not only with our programs and delivering out your programs and your job duties, but also improving their quality and quantity of life too.
Excellent. Thank you for those statistics. Great illustration of what we can do here. So when you are on the WIHA website and you've logged in, you can go to the For Professionals section of the website. And when you click on Program Resources, there is a Volunteer Management button. So you can click on that, and that takes you to this page. If any of you haven't been here, I encourage you to go take a look at it. Really great information. You can see the recording that Erin did a while back. Super comprehensive. So we won't go and repeat that now because I think it's a great thing for you to be able to do on whatever time you have, whenever you have a free 45 minutes or so. Then I want to point out the 3 R's. So not only, even if you don't have time to listen to the recording, or if you've listened to it before, there's a ton of resources here. So we've got all of our recruitment resources are nicely labeled here. Whether we're identifying volunteers, selecting the appropriate volunteers, and then training them and giving them orientations. Lots of different tools that you have and you can adapt and use there. Then we have retention. So training volunteers is also part of retention, not just that orientation, but also retention, and giving them the appropriate tools and skills and resources to be able to continue with that. Because remember, the health benefits of continual volunteer opportunities is a lot higher than just those kind of sporadic ones. And then different utilization, strategic types of tools here. Then we have recognition, because we know that's also a very important part of retaining volunteers is recognizing them. And then also it's also a point, an important part of recruitment, if you think about it. So when you're recognizing your volunteers, they're going to be, spreading the word a little bit more among their networks about opportunities and things like that. So it kind of goes full circle. But different tools and strategies that you can use for recognition and evaluation in that continual loop of quality assurance and both your end as well as the volunteers. So we encourage you to take a look at those if you have not already, or if it's been a while, just to kind of re-engage with that topic. So now let's have a discussion, because we are all probably super excited about working with volunteers. We all know it's important, but what are the barriers that are getting in the way of us maybe recruiting or retaining our volunteers? And let's help each other. So we're going to break up into small groups. So we will get that started here in a minute. You're going to have a WIHA staff person and or a GWAR staff person that's going to be in your room that will facilitate some discussion questions. And really, we just want to hear from you. What are you currently doing to working with volunteers? What's working, what's not? And then we really are going to do some problem solving with each other. Like, what are the barriers that's getting in the way? And what are some ideas that we can use to problem solve those? Sometimes we hear best practices, and that's great. The best practices, we do want you to share best practices in this opportunity, but also I want to dig a little bit deeper and do some problem solving, because the best practices are great, but if you have a barrier in the way of implementing those best practices, then let's figure out how we can move forward. So I'm going to hand it over to Erin, and I think you're the one that knows how to do the breakout room. So
we'll see. All right, I'm going to open the breakout rooms, and then you should all be going directly to those. We'll see if that works.
I haven't tried recruiting we've got MCA in 3 different areas in Rock County, and I haven't tried recruiting volunteers through them, but usually those folks are pretty active people and
Mhm.
but again, maybe there are some volunteer people who are retired are busy and people collecting a paycheck, so.
Hey, we're all making it back to the same place. Success.
People.
Way to go,
hopefully.
Erin.
So I did text a message or put a message in the chat box that said we have about a minute left. Did you guys get that?
Yeah, that's how we
Okay.
got here. Absolutely.
Oh, no, I just got the notification. Maybe I didn't see it. We were talking, so.
Yes.
Yes.
I
Yeah.
didn't know if
Awesome.
the
Well-
chat box would be like for your individual breakout group or like across all, so I wasn't sure.
Yeah, nope, we got it.
Good.
Awesome. Good stuff. Thank you. So thanks, everybody. I know we had some great discussion in our group. Hopefully you had some good discussions in yours. Maybe came away with some ideas. Maybe just do a quick go around. We've got about 3 minutes. I think if we want to do a quick go around of any like aha light bulbs, like super exciting ideas that you guys are that you were able to problem solve with each other that you're gonna try. Anybody want to share?
I'm happy to share from our group. I think my key like little light bulb moment was hearing from folks about how big a deal word of mouth from volunteers to recruit new volunteers is. I mean, I think that's not something we don't know, but how much that had played a role in it re-engaging or engaging volunteers to either come back to or begin doing the program. So that's one of those things that I think we can. And that happened, you know, in talking with Jennifer Lefebvre in Milwaukee County, that happened very organically. So what is it that we can do to support more of that kind of word of mouth? You know, we do have some resources that we use for participant recruitment using word of mouth. Maybe we should be adapting some of those materials to be able to help engage and develop more word of mouth in terms of recruiting volunteers to be program facilitators or other support. So that was a big takeaway.
Great.
I can go quick from our group since I have to hop off in a few minutes, but our group talked a lot about finding facilitators from current workshops or from workshop participants. And sometimes it's not a natural thing for us to ask because we're more helpers and it's hard for us to ask. So just making it easy too for people to volunteer if they're interested. So reducing any technology barriers or, you know, people are returning phone calls when they're being called. So just kind of that easy button, I guess. And I think the biggest barrier that we talked about was just the big investment, not only of the organization to invest in paying for a volunteer to be trained in a program, and then, you know, the commitment on that volunteer's part to, you know, facilitate 2 or 3 classes a year or 1 to 2 classes a year. But a lot of our organizations that were in my group talked about making a big investment, and then that volunteer kind of went away for various reasons. So there was a lot of investment up front, and then they ultimately didn't get any programming from it.
Mm-hmm. Well, our group shared kind of big takeaways from my perspective. The bigger takeaways were one, mileage reimbursement is a big factor that brings people in, or at least helps with retention of volunteers, because the financial burden on volunteers can be quite a lot. So that helps with that. And then 2, Amy in Brown County shared that they do a presentation that they named "You Have Something Beautiful to Share," and they present it to the UW Green Bay's Lifelong Learning and different clubs around the area and different places, and they have had pretty good recruitment from the presentation like that. So I thought that was really cool.
Awesome. Looks like Noreen put something in the chat too about mileage reimbursement for volunteers. So check it out. Great. Yeah, our group too, we also, pointed out the whole, investing into finding volunteers and then not having that not able to like follow through, or them not being able to follow through for whatever reason. So just continuing to engage through workshops was a big thing. We had another idea. Somebody had an idea in our group about utilizing students to help get the word out and get things started and things going, whether it's at tech school or whatever, there's other kinds of groups that we can look at incorporating into our volunteerism efforts. So yeah, great. Awesome discussions. I wish we had even longer to talk about it, but you'll be seeing some things. We'll be following up with, like I said, specifically, there's not a whole lot people left. I think everybody left after the breakout and we're getting to the end of time. So I do want, Suzanne has also prepared just a little bit of some reminders for when it comes to like peer facilitators for stepping on. We've gotten a few questions lately nationally, as well as here in the state of Wisconsin, about how to support our peer leaders, peer facilitators for stepping on. So we will have some more information about that in the WIHA update. We can talk about it again at next office hours, but I encourage you to take a look at we always direct people back to the website because all the great information is there. But on the Stepping On program resources page, there's a whole section on peer facilitators and training them and what kinds of materials that they can get, things like that, because we so value those volunteers in general with health education programming, and you all do too. But we want to make sure that we're lifting up specifically those stepping on peer facilitators and peer volunteers, because they play such an incredible role in the Stepping On program, and it's unique to all. There's other programs, obviously, we can have volunteers to be facilitators in, and that's great. And it's still very appropriate to be recognizing them as well. But just so that we are clear at WIHA how much we recognize those volunteers. And Stepping On is a little bit different because there's the facilitator level and then the peer facilitator level. They don't always have access to the same materials and things like that, but the support is definitely there. And we want to work with you in making sure that your volunteers feel supported in Stepping On and all the programs. So utilize the WIHA website information. Connect with Suzanne specifically when it comes to Stepping On peer facilitators. She's got lots of great ideas of how to support those peer facilitators and make sure that they have the resources that they need to do a job that they want to do and contribute. So thank you, everybody.
Yeah, thanks, everyone. We have 1 minute left. So what if we give you back 1 minute and say thanks for joining us today, everybody, and watch for the WIHA update. The recording will be there if you missed any part of this, as well as the resources we talked about today. So thanks for joining us. Have a great day, everyone. Get some sunshine.
Thank you.
Be well.
Thank you.
Thank
Have
you,
a good day,
everybody.
everyone.
Take care.